Hello, today I will demonstrate the gluteal region. Now in the gluteal region we have the muscles which are arranged in three layers. First we have the superficial layer. In the superficial layer we have two muscles, one is the gluteus maximus and the tensor fascia lata, and in the intermediate layer we have the muscles like the gluteus medius, the pyriformis, the Obturator Internus with two gemellus. We have superior gemellus and inferior gemellus, and then we have the Quadrus Femoris, and also we see the origins of the hamstring group of muscles in intermediate layer. Then in the deeper plane we have the muscles like the Gluteus Minimus, then you have the reflected head of rectus femoris, and also the tendinous insertion of Obturator Internus. So these are all the muscles we see in the gluteal region. So I will demonstrate all these muscles, their origin, insertion, nerve supply, action, and other structures under cover of Gluteus Maximus in the cadaver. So the gluteal region. Now this is the gluteal region. We have the muscles, you have some important vessels and nerves in this region. So this gluteal region, I have reflected the skin, the superficial fascia which is thick over here, and the deep fascia of this gluteal region, it is called as a gluteal aponeurosis. And not only that, the superficial fascia is contained with a thick fat which is a subcutaneous fat which is more abundant in this region. Now moving on to the extension of gluteal region, this gluteal region extends above to the entire length of the iliac crest. So this is iliac crest. So above it is extending from the iliac crest, and below if you see there is a gluteal fold. Here you will have the gluteal fold, and behind you have this is the sacrum, and in front the gluteal region extends as a vertical line extending from the anterior superior iliac spine to the greater trochanter. Okay, so I have reflected the skin, the superficial fascia, and also I have removed the deep fascia of this region. So this muscle is the gluteus maximus muscle. This gluteus maximus muscle, it takes origin from different points, like it takes origin from the gluteal surface of the ilium behind the posterior gluteal line. Then it takes origin from the thoracolumbar fascia. Okay, it takes origin from the gluteal aponeurosis, which is nothing but the deep fascia of this region. It also takes origin from the dorsal surface of the sacrum and coccyx, and also it takes origin from the sacrotuberous ligament also. Now this is, I have cut along the origin of the gluteus maximus muscle. Now I am reflecting it towards its insertion point. The insertion of this gluteus maximus muscle will be inserted onto the 1/4 of the muscle is inserted onto the gluteal tuberosity of the femur, and 3/4 of this muscle is inserted onto the iliotibial tract. This is the iliotibial tract, which is nothing but thickening of the fascia lata on the lateral aspect of the thigh. Okay. Now this muscle, if you see the nerve supply, it is supplied by the inferior gluteal nerve. Now as I have reflected the muscle, you see this nerve. So this nerve is continuation of this. So this is the inferior gluteal nerve and inferior gluteal vessels, and action of this muscle, if you see, this is it has got it's an extensor of the hip, usually in running and climbing. It is a strong lateral rotator of the hip joint, and it is also a powerful abductor of the hip. This is all about the gluteus maximus muscle. Now once the maximus muscle is reflected towards its insertion point, you see the other set of muscles over here. Okay, the intermediate plane, it is contained with this muscle. This is the gluteus medius, this is pyriformis. Okay, then we have the superior gemellus, inferior gemellus, and in between you have the tendon which is called as the obturator internus tendon, and we have this rectangular muscle which is quadratus femoris. Likewise, and you also see the origins of the hamstring group of muscles also will be seen in the intermediate plane of the gluteal region. So I go one after the other. So once this gluteus maximus is reflected, you see this muscle. Okay, this is the gluteus medius muscle. So this gluteus medius muscle the origin of this muscle, it takes origin from the outer surface of the ilium between the posterior gluteal line and the anterior gluteal lines, and this muscle is inserted onto the lateral surface of the greater trochanter along an oblique ridge, and the nerve supply of this muscle is, it is supplied by the superior gluteal nerve, and action of this is, it is an abductor of the hip and the medial rotator of the hip. So, if I cut this muscle along its origin, now it is, you can see these nerves, this nerve and vessels, these are the superior gluteal nerves and vessels which are innervating and supplying to the gluteus medius muscle. Next, we have, once I reflect this gluteus medius muscle, you can see this muscle. So, this is gluteus minimus, this muscle is gluteus minimus muscle. Deep to gluteus medius, you have the gluteus minimus. So, I have cut the gluteus medius along its origin to, and have reflected it to see the deeper muscle which is gluteus minimus. This gluteus minimus muscle, it takes origin from the gluteal surface of ilium between the anterior and inferior gluteal lines, and insertion of this muscle is onto the lateral part of anterior surface of greater trochanter of the femur, and it is supplied by this nerve. You can see these nerve and vessels, superior gluteal nerves and vessels, and action is, it is an abductor of the hip and also the medial rotator of the hip. Both medius and minimus will have the same action, and if the superior gluteal nerve is damaged, if this nerve is damaged, that will lead to the palsy of gluteus minimus and medius, that results in a positive Trendelenburg sign. The pyriformis muscle, this is the pyriformis muscle, which is a triangular muscle. This pyriformis muscle, it takes origin from the sacrum and posterior inferior iliac spine. Then it also takes origin from the capsule of the sacroiliac joint, and also few fibers of this muscle is taking origin from the greater sciatic notch, upper margin of greater sciatic notch. And when you see the insertion of this muscle, it is inserted onto the apex of greater trochanter. So, origin, and this is the insertion of pyriformis, and the nerve supply of this muscle is supplied by twigs of S1 and S2 sacral nerves, and action of this muscle, it is in extended thigh, it acts as lateral rotator of hip, and in flexed thigh, it acts as an abductor of the hip. Then moving on to the next muscle, this is the sciatic nerve. Now I am just separating the sciatic nerve to see the other muscle. Okay. Now this one, this tendon, this is the obturator internus tendon. Obturator internus tendon. This obturator internus tendon, obturator internus muscle, it takes origin from the inner surface of the obturator membrane, and not only that, it also takes origin from the ischiopubic ramus and the body of the ischium, and inserted will be like, it is reinforced by gemelli and inserted to the medial surface of the greater trochanter above the trochanteric fossa, and this muscle is supplied by nerve to obturator internus, and action of this muscle is, it is a lateral rotator of the hip joint. And just above this obturator internus tendon, you see these fibers, yeah. This is the superior gemellus. The superior gemellus, it takes origin from the spine of ischium, and it is inserted to the obturator internus tendon, and the nerve supply is, it is supplied by nerve to obturator internus, and action of this, it is a lateral rotator of the hip joint. Then below this tendon, you have this muscle, yeah, this one. Now this is the inferior gemellus. This inferior gemellus muscle, it takes origin from the lesser sciatic notch and also from the ischial tuberosity, and this is inserted into the obturator internus tendon, and the nerve supply is by nerve to quadratus femoris, and action of this is, it is also a lateral rotator of the hip joint. So these three muscles, this is superior gemellus, this is inferior gemellus, in between these two muscles you see this tendon, this is Obturator Internus tendon. Together we call this as the tricipital tendon. Next move on to the this muscle. So this is the Quadratus femoris muscle. This Quadratus femoris muscle is a rectangular muscle, and it takes origin from the external surface of the ischial tuberosity, and it is inserted onto the quadrate tubercle. And the nerve supply is by nerve to Quadratus femoris, which is formed from the ventral ramus of L4, L5 and S1. And action of this muscle, it is a lateral rotator of the hip. So this is all about the Quadratus femoris.